It requires an unfaltering courage to act year after year upon the belief that the abominations of society can only be done away with through the steady impinging of fact on fact, of interest on interest, and of will on will.
The Jane Addams Hull House approach involves the knowledge needed for social change, the compassion to support the change, and the means and skills to accomplish that change. Hull House is an organization that you have to have the spirit of Jane Addams. That spirit lives on today. Those individuals who are willing to take risks, be involved in changing the lives of people, including children, families, and bring about change in the community are living in the Jane Addams spirit. What makes Hull House, again, unique is that we address problems on a personal basis. We take one problem at a time, we address it one problem at a time, like you address one family at a time. And we try to make sure that we keep things in perspective and don't get caught up in the millions and the hundreds of systems that are out there. And when you look at the programs that we have initiated, like Families for Better Life, like Neighbor to Neighbor, it's based on one model, developing that model. And when and if it works, then you expand it. And before you know it, you've taken on the whole system and you made the system change. Jane did the same thing. When she started juvenile court here in Chicago, it started in Chicago, but look at it now, it's all over the country. And we're fulfilling, I think, many of the things and the areas that Jane was interested in is addressing one problem and one family at a time.
I want to destroy the welfare mentality. I want to break their belief in victimization. I want to encourage people to take responsibility for their lives so that they can reach whatever is their greatest potential.
Winfrey says she will move 100 families from various Chicago Housing Authority developments at an estimated cost of $30,000 per family. Each family will
Families
go
for
through
Better Life is exactly what it says. It's providing a better life for families that want to make a change. And to have someone like Oprah Winfrey willing to put her personal dollars and her reputation in line with Hull House is very important. We believe that people will change if they're given help, the guiding light, the beacon that will show them the way. We believe that Families for a Better Life will be a program that will have impact on the welfare system of this state and in this country.
You just can't give people housing, and you just can't give them money and cars and things. You have to instill with them the desire to get it themselves.
Like the Families for a Better Life program, Hull House Association takes a comprehensive and community-based approach in our foster care program. Neighbor to Neighbor is the first of its kind in the nation. The overall design of the Neighbor to Neighbor program comes from a personal experience. Experiences I had at DCFS where I saw children who were torn from other children, their brothers and sisters, placed in different foster homes and not seeing their brothers and sisters for years or maybe forever. This program is designed to keep the families together, to keep them so that they can grow and develop together.
The Neighbor to Neighbor program works on the goal of trying to meet the needs of the entire family unit. The program is certainly child-centered, but the child's world doesn't just exist with the children. It involves also the community from which the child came, the people from whom the child came, the birth parents, other relatives, the community and friends who care about the children. All of those things have to be looked at when we try to maintain roots, when we try to maintain ties for children to their cultural history. Neighbor to Neighbor is different from most other foster care programs in several ways. One is that we are specializing in sibling groups. So we're taking 3 or more children at a time to keep brothers and sisters together. That's different from most foster care programs, which really take single children.
Caprice, there's chicken pox, And what you should do is put the calamine lotion over his face, and we'll cover it. That'll prevent.
But we want our foster caregivers to be focused on providing service to that one family. We're community-based in an effort to keep children in the communities of origin. That makes the children accessible to their families so that we can maintain and encourage a high amount of parental involvement with the children.
In reuniting the family, the Neighbor to Neighbor program has provided us with the resources to support that family and to provide it with the resources necessary to keep that family together. The family that I have currently here now lives about 1.5 miles from here. At nighttime, if she should come by, she can easily come here. If she needs to be picked up, I can just run over there and pick her up. I've taken the children just 1.5 miles away to see their house, you know, where they will be coming back home to.
Of course, many people know about our unique feature of having our foster caregivers be salaried employees of the Hull House Association. The foster caregivers receive a salary, and in addition to that, they have health benefits, dental coverage, vacation time, life insurance, just as any other Hull House employee would have.
Part of my job is to provide a progress report to the Neighbor to Neighbor program on my observations of the therapeutic visits that occur here in my home. And what I've indicated here is from the day the children arrive in my home, what took place, who brought the children.
That enables those foster caregivers to then pursue the role of taking care of these children and their special needs in a professional way, and to really do all of the things that need to be done.
This particular family, mother visits us at least 3 to 5 times a week. She spends 3 to 5 hours with her children, sometimes per day. The mother comes here and she does laundry, she washes dishes, she cooks, she maintains every aspect of a mother that a mother should for her children while she's in my home. Actually, it has been, she's an extension to our own family now.
I think that Neighbor to Neighbor could easily become a model for the rest of the country in this area of child welfare. Research shows us that one of the most difficult things for children across the country and in other parts of the world is not just to be separated from their parents, which is certainly painful enough because children don't always understand why that's necessary, but also to be separated from their brothers and sisters. I have many hopes for the Neighbor to Neighbor program. We are unique. No one else in the country is doing this type of program right now. I know that it's making a difference in the lives of children, and so my main goal for Neighbor to Neighbor is to do more of it.
Hull House needs to become more of a bigger player in a change of social policy in the city, in the state, and nationally. Hull House has the wherewithal to do it, and I believe with the support of the board and the talented staff that we will accomplish that. Whatever we do is a model that's developed in this community, hopefully will be adopted and adapted by other communities to see and help them to change the way that things are going on in their communities. We believe that Hull House has something to teach others because we take seriously the need to help people change their own lives. And I believe that there are many people in other states and other cities that want that help too and are looking for agencies such as Hull House to help them to find those solutions.
They talked about their story, their hardship, about how they perhaps started with no chance, how they had been in public housing for a number of years, how they found themselves with children now and no way to make it better for them. And so their focus changed to their children. Most people spoke about their children and wanting something better for their children, wanting somehow to hold out hope for them, a better life indeed for them, not knowing how, but somehow sensing an opportunity at the end.
The payback for volunteering will be to see Eva someday stand on her own, someone who one day will be able to help others, someone who at one time in her life needed a helping hand, saw hurdles in front of her and was able to use our assistance to get over those hurdles and then make it on her own.
we feel, but the strength of healing in child welfare is within the family. What you try to do with foster children is give them all of the healing benefits that life in a healthy family can offer. Love, acceptance, guidance and discipline, and the building of self-esteem.
One of the most moving things that I've experienced is that when I took the children to visit their parent, their mother in her home, where she has gotten a bed for them, and we've also provided dresses for her and taken them back to the home, the kids start to identify, that's my bed, that's my bed. And it was like, they're coming home, they're coming. You get the feeling that they're coming home, you know. And that was real moving and touching, you know. And it let me know that the kids, they want to be with their parents. And so that's what I keep fighting for.